So we were joking over here about closing your eyes and whether or not that makes a difference. But in reality, in order to get better at what we're trying to do, which is trying to get better at palpating, it takes a certain degree of concentration. And the thing that I find most frustrating about manual therapy in general is that a lot of us tend to deal with athletes, and we see these athletes practicing and training and doing repetitive drills in order to get better at what they do. Whereas for manual therapists, where we're actually also using our physical bodies to accomplish a goal, so we're trying to perform an art and a science simultaneously just like an athlete would, we always assume that we're going to get these skills automatically. And that once we have them, they never go away, and that they don't require any further training. Which is really frustrating because every physical skill requires training. Now, the question is, how many of us actually train on a daily basis? Most people get into work, they have their clients, they kind of have the diagnosis in mind, they rub this, crack that, mobilize this, stretch that, and then they go on to their next patient. But they're not actually training. So the amount of skill that we can develop through the course of our practice sometimes amounts to whatever you learned in school and then stops. So there is something to say about getting incredibly amazing at what we're trying to do. And we can scoff at other people who don't want to, you know, we talk about athletes who are gifted so they don't train. We say they're so silly, they should train because they get so much better. And then we go ahead and we just start cracking this and rubbing that and doing nothing and not training. So where does the training occur? The training has to occur on every patient that we touch. The kind of things which I really try to focus on during the seminar is take the time to practice your skill, hone your skill, as opposed to going to several seminars and waiting for someone to tell you the technique that'll fix everything or the assessment model that'll fix everything. Nothing will fix everything. We got to get better at basics, which is touching people, feeling problems, and then fixing problems.